Here is your question. Sorry. Okay, so if you have read and understood, considering this history-taking session, kindly please begin.
Hello, I'm Dr. Ashu, one of the surgical candidates. May I confirm your name and age, please?
Okay, doctor. I am Steve, 40 years old.
Nice to meet you, Steve. Today I've been asked to ask you a few questions regarding your problem. During the conversation, I'm also taking some notes. Are you okay with this?
Okay, doctor.
How can I help you, Mr. Itish?
I have a headache since 5, 6 months.
Okay, Mr. Itish, I'm so sorry to hear that. Uh, can you please tell me where exactly? Do you need any painkillers before we proceed?
No, it's fine. I took some medication in the morning.
All right. Can you tell me exactly where do you feel the pain? Point to the site of the pain.
Okay, so the pain is mostly on the front side of the head.
All right. And when did you first notice?
As I told you, I noticed it 5, 6 months before.
Oh, okay. All right. And was it sudden in onset or gradual?
It started suddenly, but now it's gradual. It's almost every day on and off.
All right. How it has progressed? Like it is increasing or decreasing over the time?
Yeah, I think now it's increasing with time.
All right. It is very difficult. I can see that. And can you tell me about the character of your pain? Like uh, dull pain, throbbing pain, or like sharp shooting pain?
Yeah, I think it's a dull aching pain most of the time, but sometimes it's sharp.
All right. And does it move to any other part of your body?
No, not really.
All right. And can you tell me, does this have any relation to the time of the day? Like it is worse in the morning and better by the end of the day?
No, most of the day is throughout the day, but it increase maybe in light.
All right. And do you feel di- difficulty in light, or do you have any difficulty in your vision in light?
Yes, I feel some problem in my vision, in my eyesight, and it increase in the light.
Okay. Do you want me to dim the light of the room?
I know it's okay. I can tolerate.
Okay. All right. So we can proceed, right?
Yes.
Okay. Can you please rate your pain from 1 to 10, considering 10 being the worst ever pain you have endured?
Okay, I can make it 5 or 6.
All right. Is there anything which makes your pain worse or better?
If I take some rest upon closing my eyes, it improves a bit, but most of the time is throughout the day. And when I bending
All right.
forward, it will increase, and in the so much light also it increase.
All right. Have you recently banged your head?
No,
Okay. Have you noticed any uh, stiffness in your neck?
no,
All right. And are you experiencing any rising temperatures, or have you noticed any rash in your body?
no,
All right. So have you ever had any episode of seizure?
no,
Okay. Do you feel any weakness or numbness in any part of your body?
no.
All right. What about your appetite? Has it decreased recently?
Yeah, it seems it's decreased.
Okay. And what about your weight? Have you lost some weight?
Yes, I have some weight loss as well.
All right. Can you tell me how much weight has been reduced, if you can remember?
No, I couldn't remember.
All right. And can you tell me that do you see any flashing of lights or uh, like visual disturbances just before the onset of headache?
Yes, I recently um, experienced some visual problem, visual disturbance.
Okay. Do you feel pain in your half head?
No, it's mostly on the front side.
All right. So, do you take any medicine for any other medical disorders except for
No,
this? Okay. And do you have any surgery in the past?
no,
Okay. And are you allergic to any medicine or any other substance?
no.
Is there in the family member
I
suffering
have
from
some
similar
dust
disease?
allergy.
Oh, all right.
Mm,
And is there any
Okay.
family member suffering from similar problem?
No.
Can you please summarize your history now?
Okay. Today I have taken the history from Steffi's 40 years old male presented with the chief complaints of headache in the frontal bone, front side of the head, and it has started 6 months ago, and it is increasing in intensity as well as it is progressing, and it is dull in nature, and it is moderate pain, and the patient is having no history of trauma, and that there is no history of infection and no history of a brain tumor. And the patient is giving positive signs of this flashes of light, like the patient is having. Based on these findings, I consider subarachnoid hemorrhage as my first top differential. I will consider
Yes.
other.
What other differential diagnosis you would consider?
I will also consider like migraine and brain tumor, meningitis,
Okay, good.
encephalitis,
How would you confirm your diagnosis? What investigations would you ask for?
uh, I'll manage this patient according to the first of all surgically ill patient, like critical care ill patient,
Critically.
and then in considering the airway breathing circulation is adequate, and I will send the patient for CT head
Yes.
in the first 72 hours. As well as then I can also arrange for lumbar puncture to assess for the CSF and then
Okay.
CT angiography to locate for the site of the bleeding. So it may help in the charting of the treatment
Yes. And you'll send the referral
to
for
the
the neuro.
yes,
Yes.
neurosurgical examiner.
Okay. What more could you give to the patient to
Yes,
relax the yes.
I will liaise with the neurosurgical unit, and
Yes.
by the time I'll start fluids to the patient, I'll give patient to the oral nimodipine with the
Yes. How
dose of
much? Yes.
six, 60 mg every 4 hours,
Good.
along with the laxatives and
Okay.
various surgical procedures which can be done in this patient, like
Yeah,
the
but not
any yes,
instantly. You'll wait until the labs
okay.
or reports come back. Okay. Very good. Good. you could have, right, you could have said that, yeah, after discussing with the neurovascular MDT
MD.
unit. Okay, good, very good. Right, if time would have allowed you, how would you have completed your history?
I will have completed my history by asking the family history, social history,
Yes,
and the patient's concerns, like
idea
what is
confirming.
idea concerns, as expectations,
Very good.
and systemic symptoms.
What is important in this station when it comes to the patient and the past history and the family history?
In the yes, it is very important in this case, like the patient's past history. The patient may have a case of a polycystic kidney disease,
Yes,
and some family history. There may be a death also, which could be due to the
aneurysm in the brain.
aneurysm ruptured.
Yes, patient has strong family history and strong past medical history as well in this scenario. That's why when you will make the first provisional diagnosis as subarachnoid hemorrhage, that makes sense. Very good.
Yes.
All right.